I'm Dr. David Beaulieu, and I'm back with more news you can use. I had an interesting week this week. I was looking at a study that came jointly from UCLA, Mary S. Easton Center for Alzheimer's Disease Research, and the Buck Institute for Research on Aging. And it was the first big study to suggest that memory loss in patients may be reversed. And improvement sustained using a complex 36-point therapeutic program that involves comprehensive changes in diet. That's comprehensive changes now. That means big, okay? Brain stimulation, exercise, optimization of sleep. We've talked to you about all of this stuff. Specific pharmaceuticals and vitamins. I haven't talked to you about specific pharmaceuticals. In fact, I feel they play virtually no role, but in order to get funding, I think they had to put the pharmaceuticals in there. And multiple additional steps that affect brain chemistry. And I looked at this very, very carefully. These were published in the Journal of Aging, by the way. And basically what I saw was a program that eliminated all simple carbohydrates, leading to weight loss, eliminating gluten and processed food from the diet, increased vegetables, fruits, and non-farmed fish to reduce stress. Yoga was introduced. Meditation to reduce job stress. Melatonin to help sleep. Sleep improvement from 4 to 5 hours of good sleep a night to 7 or 8 hours. Taking the methyl forms of B12 and folate, because most people with dementia have a SNP or a genetic variation that makes it hard for them to use B12 and folate, so you've got to use an end product. Vitamin D, unsaturated fatty acid supplements, CoQ, and something that we weren't doing. They used increased oral hygiene using an electric flosser and electric toothbrush. Thought that was very, very interesting. Fasting for a minimum of 12 hours between dinner and breakfast, and for a minimum of 3 hours between dinner and bedtime. Exercising for a minimum of 30 minutes, 4 to 6 days a week. And the results were amazing. And it's the first successful demonstration that you can reverse Alzheimer's dementia. Now, the downside of the program was the complexity. And very, very few patients were able to stick with the entire protocol. We don't run into that very much in my office. When I read this, I thought, I wonder where they got that. With the exception of the drugs, which have proven to be ineffective, by the way, and the electric brushing and flossing, that's a protocol we've used in my office now for a number of years. And we've seen dementias improve dramatically. But this is the first of the studies that are out in peer-reviewed publications demonstrating that these terrible diseases, these dementias that rob us of our joyful, productive, functional old age can be controlled and can be reversed. If you don't believe me, argue with the scientific literature. We're doing it. We've been doing it. It's doable. And if you've got people in your family who are suffering, not doing it is incredibly foolish. See you next week.